So we'll be giving you a scenario with a number of options. Collectively, you'll make a decision, and on the basis of the majority, we will then move on to the next step in the path, the next node, depending on what the majority wants. You'll then read the next node, and we'll continue with the same process. You'll be making, I think, a maximum of 3 or 4 decisions. They shouldn't take more than 15 or 20 minutes. So we're going to give you 5 minutes, no more than 5 minutes, to read the case and to discuss it in groups of 2 or 3 or whatever is most convenient. Once you've done that, I'm going to ask you to put your hands up. I'm going to go through the options and ask you to put your hands up, okay? And I'll just try and work out roughly what the majority is. Alfred Stokes is a 78-year-old gentleman, admitted yesterday with suspected aspiration pneumonia. He is very poorly and confused. His chest X-ray confirmed right lower lobe pneumonia. I think he has septicemia and needs urgent treatment. Mr. Stokes was diagnosed with Lewy body dementia 5 years ago. So your 4 options is starting on IV antibiotics immediately, don't give antibiotics now, see some other patients first, seek advanced statement, or assess capacity. I'm going to give you a couple of minutes to discuss those options amongst yourselves. I think A is the right answer. Okay, so that's definitely a minority. Okay, so B. Any hands at all? No. C. Okay, and D. Because D wins. And D tells you that Alfred had an advanced decision, which stated Alfred did not want any life-saving treatment, including antibiotics, once his dementia became debilitating, once he had lost most of his cognitive capacities. The GP also notes that if you had contacted him earlier, he would have been able to help you to come to a decision about what was in Alfred's best interest. He also gently reminds you that an advanced decision is legally binding, if it's valid, and that you have a duty to try and find out whether such a decision existed. I apologise for the fact that many of you did want to but not all of you did, so I suppose this is a valid point. And I think, is that it, Alan? Okay, so that was a hopelessly inefficient way of presenting it. There's numerous errors, but what Arnold is going to send you some feedback forms in the next 7 days, and we would hugely like you to fill out that feedback form. Clearly, we apologise for the way that it went. It wasn't quite anything like as smooth, and the fact that we couldn't use our lovely technology either. But what we're interested from you is whether this is a good way of delivering this style of ethics. You're familiar, I think, with having a case, which is a static one-slide case, followed often by another static one-slide case with the answer of some kind. What we're trying to do here is drive towards a much more interactive, multiple-choice option style. But one of the difficulties with that I'm already picking up is that you want to know what the right answer is, as opposed to the answer that you're following. We're partly actually in debate as to whether we should give you that information or not, and how we should give it, whether we should give it in the lecture or after the lecture on Moodle and so on. But not thinking that it's a good idea or a bad idea. So hands up a good idea to have this kind of thing. And a bad idea, and be honest if you think it is a bad idea. Okay. And for those of you who think it's a bad idea, why? Do you think it's the specific case, or do you think it's the whole concept is just...
I think in this case, there are times where you would do 2 things at once.
Okay.
So you just pick one.
Mm-hmm.
But in a situation where neither is correct, you'd always go for advanced directive and contact people at the same time.
So the issue there is a specific one about the fact that the way that we've worded it, perhaps in the option. But what about the idea of using this as, okay. Does anybody have a general criticism saying, no, this is hopeless, this just shouldn't be done, and we should get on with doing a normal lecture?
Not quite that, but I just wondered when would you use it in lectures or instead of PBLs?
We haven't decided, so it could be in lectures, it could be in PBLs, it could be as SDL for self-directed learning on Moodle. We haven't decided any of that yet. On that note, how many of you think this would be a good to use in lectures, as we've just done it? As a component of, not as the whole lecture, but very much as we've done it now.
If you had those things working,
Yeah, well, if you have the gimmicky technological stuff as well, then that would presumably improve it more. Okay, so can you put your hands up again for that, if you think this is a good way of doing it in lectures? Okay, And do you think this would work in PBLs? Hands up for that. Because my ignorance of PBLs, okay. But you haven't done any ethics, presumably, in that style. Okay, and SDLs, would you prefer to do this in your own time? Because you wouldn't do it? You wouldn't do it? Okay. And lastly, before I let you go, because we haven't given you any, and part of the difficulty of doing this is giving you the answers, as it were, because it's quite, because we want you to go down a pathway. It's quite hard for us to say, well, actually hold on a minute, go back, take another step, try another option. How would you, I mean, would you prefer to have the answers, as it were, the correct route, as it were, at the end of the lecture? So we actually say, well, okay, this is what you did, let's go back and do this is what you might have done.
Yeah.
Yeah.
If the whole page was up somewhere where you can access it and go back through and see what the other choices would have made, what choices came out with the patient alive and happy.
Okay, because one option is for us to give you this case on Moodle after the lectures. You can go down all of the options, but the problem with that is that it's time consuming, and I'm not sure that most or all of you would do it. And the idea with that is that we put the answer, as it were, at the end.
Do it as well as to do it in the lecture and afterwards you can...
Yeah, that was the idea. So we'd give it in the lecture, and then we'd give you the opportunity to go down all the options in your own time.
In PBL, we get a map of where all the options go, so you can just put that at the end of the lecture.
The general map.
Yeah.
Okay.
And then you can follow it down with your eyes.
Okay, good.
Unless you're in a lecture, you can't ask questions and stuff. That'd be a bit pointless, really. I mean, I know if I was doing it by myself, I would have asked them completely differently.
Okay. Okay, well that's interesting.
And then wouldn't have known really what I'd done wrong, and then got really frustrated because I was asked. So
Okay, that's interesting as well.
Altogether.
Because we're not sure how much the lecturers should be involved, and how much we just let you get on with it, or how much we should kind of interject and ask you why you make the decision. So that's something else we're going to be looking at. But that suggests that you want that kind of interaction from us. There's a question there.
You don't have to make the case a public case on TV soon and let people access it.
You can, yeah. It's actually publicly available. We can make it public. Okay, so thank you very much for coming along and for listening to the Harness. Can you give a special thanks to Arnold and Olive for Okay, so thank you very much for coming along and for listening to the Harness. Can you give a special thanks to Arnold and Olive for